Hello, everyone. My name is Hannah Van Slambrook, and I'm the Director of Enrollment Management for the School of Public Health. And we're so happy that you've decided to join us today. Without further ado, please welcome Dr. Ella Austin. She received her PhD from the University of Virginia, as well as her MPH from the University of Florida. She is our Associate Dean for Academic Affairs, so she handles all things students and curriculum at the UAB School of Public Health. This is going to be more of a Q&A, and I'm going to go ahead and start us off with a question. So one of the first questions, so I know you had a whole other career before you started public health. How did you get there, and what sort of drew you to public health?
That's true, I did. So as you said, I got my PhD from the University of Virginia, and that was in sociology. And I actually started my career as a sociology professor here at UAB way back in 2006. And I was really drawn to UAB because at the time, this was really the epicenter of the HIV epidemic in the Southeast. And there was a lot of research being done here. And since my background is in HIV research, I really wanted to be a part of that. So I came here, I was faculty in sociology, and I kept getting all of these incredible opportunities to go out and work in the community. I was continuing to work in HIV, doing sort of studies, exploring African-American women's attitudes toward a potential HIV vaccine in the future, doing a lot of work on LGBT health. And at that time, when I was in sociology, all of my annual reviews kept saying, yeah, you need to spend more time in your office just sitting quietly and thinking about things, and developing theories and writing things down. And I was just like, what? Because that just was not who I am and who I wanted to be. And so I realized pretty quickly after I started telling a lot of our sociology undergraduates that they should go get an MPH, I realized, maybe I should also go get an MPH. So I ended up leaving UAB and went to work for the Department of Veterans Affairs on several studies of veteran homelessness. And that was really fantastic because I really got to see how policy gets enacted and all of the different barriers and facilitators to really changing large-scale organizations. And at that time, I started working on my MPH. And also at that same time, UAB was developing their undergraduate public health program. And so I sort of realized, I have experience teaching undergraduates. Not only that, I have experience teaching undergraduates statistics, which no one ever wants to teach. And so I started just kind of showing up at the School of Public Health and, hey, remember me? I used to work at UAB, I can teach stats. And after several years of just sort of asking for a position here at School of Public Health, it finally worked out. And I came here in 2015 after I had earned my MPH degree. And I'm in the Department of Biostatistics, and I teach introductory level biostatistics to undergraduates and to master's students. And then in 2017, I guess, I was asked to step in as the Associate Dean for Academic Affairs. So it's been just such an incredible journey for me, such a great way to be able to use the things that I'm passionate about and to have those things really matter. No one in the School of Public Health would ever say you should sit quietly in your office and think about things. The expectation is that we're out in the community making an impact. And so it just fit perfectly with who I am and what I wanted my career to be.
You have a very unique experience when you went through the application process as an MPH student. What did you look for when you were applying?
Yeah, so because I knew that I was going to be working full-time while I was pursuing my MPH, I was looking for an online program. Now, I should say, I didn't look at UAB, and nothing against UAB, but I knew everyone here, and that would be weird. Like, you're a friend of mine, also you're my professor, that just kind of be strange. So I didn't look at UAB. But what I did when I started looking at programs was I pulled different lists of the best online programs. I found a list of the most affordable MPH programs. And I did a lot of research on all of the schools at the top of each of those lists, and really, sort of did some comparing and tried to figure out, okay, well, what is the, best ranked program that is also very affordable? And, after doing all of that work, I was able to find a program, and I went in and I looked at their website and I looked at their courses and really thought about whether that was going to be the right fit for me. And I found a program that was the exact right fit for me. And it was the program that was highest ranked and that was most affordable of the ones that I was looking at, because I should say that there was exactly one program that was higher ranked and more affordable than what I was looking at, and that was UAB. So if those are things that are important to you, a well-designed, high-quality program with lots of opportunities for students and affordability, I mean, you're in the right place. This is where you want to be.
Awesome. So what are some tips that you have for being successful in an online program, particularly in our current climate? It's so important to consider right now.
Yeah, absolutely. So, whether or not you were planning to be an online student or whether you're planning to be on campus, the reality is that at least for the summer and, possibly into the fall, we just don't know yet, courses are offered online. And so we need to, have skills and in place to be able to be successful in that environment, because that's just our reality right now. For me, I think the most important thing was really scheduling. So I was working full time, but I did have a lot of flexibility during my workday. So I was able to do some schoolwork at that time, but really just figuring out at the start of every single semester, okay, this is everything that I have to do in this class. This is everything that I have to do in this class, and so on. And having a big master list of everything that was required. It's gotten so much easier now because, like, the LMS, the learning management system that we use here at UAB, Canvas, actually has one comprehensive calendar. And so you can put everything into that. So that would be a great way to organize all of your due dates and whatnot too. But just really, treating even online courses as if they're real courses. I think, from a faculty member's perspective, that's the biggest mistake that people make, is that they think that an online course isn't a real course. We don't have to be there at a certain time. So, 2 weeks go by, 3 weeks go by, and you've never been there. You've never done any of the work. And it gets to the end of the semester and you're like, oh no, all right, I'm going to do all my work now. But that's not how any of this works, right? Online courses have deadlines throughout the semester. And so I think that that's the biggest misperception that students have, and the biggest adjustment that people have to make is really being, just diligent about staying on top of the work. That's the biggest tip. And whenever I teach online, whenever I advise students, that's the number one thing that I tell them. That, it's very easy to be scheduled when you're attending classes, because you just have to show up a couple times a week, and that, you're putting in your time that way. But online, it's different.
Awesome. Dr. Austin, that is great advice. And for students who do have questions, because I have one more question for Dr. Austin before I'm going to open it up. If you'll just send me your question, and then I'll go ahead and tell her. I'll group, particularly if we had a question, a bunch of questions around the same topic, we'll just go from there.
Okay.
Awesome. So I know you've been doing a lot of work around the new core curriculum in the MPH program. Please tell us why you're so excited about it.
Oh, Hannah, I'm so excited about it. So in 2016, the Council on Education for Public Health, SOPH, which is our accrediting body, came out with new competencies that all MPH students, these are skills that all MPH students need to have. And when we looked at those competencies, they are all practice-based. They're about what can you do out to serve the community. And when we looked at our curriculum and looked at these competencies, we just said, oh no, our current curriculum is not going to meet this. So we need to completely redesign. So I had all of these big ideas for how we were going to redesign the curriculum. And one day the dean said, you know, I spend a lot of my time providing training to public health practitioners, so people in departments of public health at the county and state level, providing training to them in evidence-based public health. And I've looked through these competencies and they really seem to match pretty well with this evidence-based public health model, which, wait for it, is actually an evidence-based model. So there's evidence that this model works effectively to train people to be public health practitioners. And so, you know, the dean said this and I was like, are you thinking what I'm thinking? And he said, I'm already there. We're doing it. We're going to redesign our MPH curriculum around the evidence-based public health model. If you're not familiar with this model, do a quick Google search and pull it up. It's a sort of circular model that starts out with assessing the community and then quantifying issues, moves into implementing programs, and then comes back around. Okay, did that work? All right, let's go through it again then. And it's just such an incredible way to capture all of those skills that we need to have in public health practice. So we have completely redesigned our MPH core curriculum. Those are the core courses that everyone takes together into a set of courses that people take over 2 semesters. They start taking their concentration courses at the same time because we know that people come for the concentrations. People are excited about EPI and health policy and these sorts of things. So you take your concentration courses and the core at the same time so you can develop those 2 skill sets and take those with you into the applied practice experience or the internship that students engage in. So it's such an exciting time. It has just really, you know, revitalized so many of the faculty, really gotten us excited about getting to teach what it is that we all love to do. So it's just, it's going to be such an exciting next couple of years here at the School of Public Health. And I can't wait.
Awesome. That's so exciting. I know we're all really excited about this core curriculum, and you guys entering the MPH program will really enjoy it. Let's see. So I have one question that just came up, and it is about the application procedure. So I will go over the application procedures during my presentation. But we have a question about the new core curriculum, which is what skills will be developed with the new core curriculum?
Oh my goodness. Okay, so there are actually 22 competencies that will be addressed in the new core curriculum. And they sort into sort of, you know, 5 or 6 big areas. One big area is evidence-based public health research. So it's really focusing on how we use biostatistics and epidemiology skills to quantify issues, to gather information, to examine trends and prevalences, and then communicate that information. As we're seeing right now, it is so critical to be able to communicate scientific and statistical information to a public audience. There's also a whole section of skills, and this is the part that's really new to what we will be training students in, having to do with how we actually do the work of public health. So there's a large emphasis on interprofessional practice because all of us in public health work with other professions all the time. There's a lot of emphasis on teamwork, on systems thinking. There's large sections on thinking about how we develop and analyze policies and programs, and then how we actually assess communities. You know, in public health, we need to be responsive to the concerns that communities have. So how is it that we find out from communities what their leading health concerns are so that we can start to develop appropriate programs and policies to be able to address health concerns that communities have? If you're interested in the specific competencies, we have just this week launched our beautiful new website. And there's an announcement about the new MPH core curriculum on that website. And there's actually a button that if you push on, it has all of the core competencies for all of our different degrees that are offered in the School of Public Health. So that's a great resource. You can also go directly to the SOPH page to learn more about why it's so critical to attend an accredited school or program of public health.
Awesome. And we have just a few more minutes left. We had a couple of questions about internship opportunities and GREs, and all of that will be covered later on in the presentation. What I think a lot of students want to know, particularly when they're navigating the application process, is what are review committees looking for? You review applications. What do you really look for, particularly in a statement of purpose?
Yes, that's a great question. So what I'm looking for in a statement of purpose is passion. A passion for public health. Most people come to public health with a sort of general sense that they want to help. And they often say in their statement, "I love people and I really want to help." Well, what does that mean to you? How are you going to use public health in order to help people? I mean, of course, that's our ultimate goal in public health, but I need to know that you have a clear sense of why specifically a degree in public health is going to help you to take that compassion, that commitment to service, that love for the community that you have, and really channel it into a specific way that you are going to help to protect the health and safety of communities. So even though you may not know exactly where you're going to end up as a career, show me that you've thought about how that passion that you have connects to your future career. That's really what I'm looking for. Some level of specificity and familiarity with the role that public health plays in helping communities.
Here are just a few accolades about UAB that some of you may know, but others may not. The first one that I would like to mention is that the UAB system is the third largest public hospital in the US. What that means for you as you go on to pursue your graduate education is that UAB is one giant resource, particularly if you choose to pursue a career in the medical field. You will have numerous resources at your disposal, including research and internship opportunities. More importantly, what that means is that you have mentorship opportunities from faculty who are the best in their field. And I'm not just talking about the School of Public Health, but across campus. Additionally, UAB is consistently recognized as a diversity champion. That means not only are we a diverse campus, but we celebrate our diversity. One thing to note is that the School of Public Health is actually one of the more diverse schools on campus, and we are very proud of that. You will enter your program with some of the best and brightest across the world. Okay. So here are just some accolades about the School of Public Health, and we are the only SOPH accredited institution in Alabama. The Council on Education for Public Health is the highest accrediting body for public health programs in the US. They work with federal agencies to help design curriculum competencies that prepare you for real-world experience in the public health workforce. So what is public health? Well, public health is all around us, but specifically it's the science and art of protecting communities. It is all about prevention. I always like to use this example. A doctor treats the patients in the clinic, while a public health professional prevents them from ever getting there in the first place. In our programs, we teach you how to educate, promote, and conduct research on ways to improve the health and well-being of your communities. Regardless of the area of public health that you choose to go into, whether you want to go into the education, practice, or research side of public health, we will give you the tools to be successful in all areas of public health. Our job is to teach you to prevent problems from happening before they ever occur. So here is just a list of common undergraduate majors. Since public health is so interdisciplinary, we accept majors from across campus. We don't require a public health degree or background to apply to a program, only that you're interested in improving the health and well-being of your community. So here are 5 different departments that represent the 5 broadest areas of public health. With a degree in biostatistics, you will be trained in statistical data analysis of human-related data. Upon graduation, you'll feel confident as a well-trained biostatistician to conduct research and analysis in all areas of public health. Environmental health sciences is the study of where health and the environment intersect. And we train you on how environmental factors impact our health, as well as how our actions impact the environment. With a degree in this department, students should also be able to develop strategies for the prevention of occupational injury and disease. Epidemiology is the study of diseases, both infectious and chronic. A degree in epidemiology will train you how to study the patterns in a patient population so you can conduct research or develop intervention initiatives. Health behavior is more the psychology of health. A degree from this department will help you better understand the why behind health outcomes, specifically the social factors that impact health. And healthcare organization and policy is the management and policy side of health. Students with a degree from this department will be trained as a policy analyst, mid-level manager at a healthcare institution, or if you choose to focus your training around maternal and health policy and leadership, there's a degree program for you as well. And here is just a list of companies that employ or have employed our graduates. As you can see, there's a mix of public and private organizations. To me, this slide represents how integral public health is to the fabric of our society. A degree from the UAB School of Public Health will prepare you to go into the workforce and be successful in every area of public health and beyond. So a common question that I get is, so what's the difference between an MPH versus an MSPH and a Master of Science in Biostatistics? Well, the MPH is a practice-based degree. If you think you would like to work with people, boots on the ground in the field of public health, pick this degree. If you're interested in more of the research side, you want to be more behind the scenes, pick a Master of Science in Public Health or the Master of Science in Biostatistics degree. It's important to decide early so you're in the program that best fits you and your career goals. So again, Dr. Austin talked a lot about the new core curriculum, but we're so excited, so I just looped it in there again. So this is just a brief message about our new core curriculum for the MPH program. It is the program that most students pursue, and the importance of this new curriculum is that it's very much practice-based, and you will be able to use the skills learned in the classroom and apply them to real-world issues. So one of the most important things to know before you submit an application is where to apply. If you're applying to a traditional MPH, MSPH, or DRPH program, you will submit your application via sophis.org. One thing to keep in mind is that all transcripts will need to be verified. This process typically takes about 3 to 4 weeks. Even if you graduated from UAB, you still have to send your transcripts to SOPH to be verified. Obviously, in the wake of COVID-19, if the deadline's approaching, you've done everything you need to do on your end, and the transcripts still haven't been verified, we're still going to send your application to review, so you don't have to worry about that. Once admitted, you will then have to submit a supplemental application to formally accept admission into the program. We do this because until this point, you aren't technically admitted into the UAB graduate school until you submit an application to our school. If you are applying to an ABM, or Accelerated Bachelor's to Master's, Fast Track, or Coordinated Degree program, Master of Science in Biostatistics, or PhD program, you'll submit that directly through our graduate school, and you don't need to do anything else. Once you're admitted, we just ask that you let us know your intent to enroll. So these are our admissions requirements for master's programs. So we do require a bachelor's degree from a regionally accredited institution, official transcripts with a minimum 3.0 GPA. We do practice holistic admission. So if your GPA is a little bit shy of that, that's fine. Consider submitting your application anyway. We do take all aspects of the application into consideration when reviewing. We also require a statement of purpose and objectives, and Dr. Austin talked on the importance of that in her presentation. But again, it's very important to talk about your passion for public health as well as why you want to pursue your education at UAB. We also require a resume and 3 letters of recommendation from an academic or professional source. The GRE is not required for NPH applicants anyway, but for this admission cycle, we're not requiring the GRE of any of our master's level programs. So just keep that in mind when you're applying. If you've already started your application, we're still in the process of moving those applications over, but if that's the only thing you have left, you should be receiving a notification that your application is about to be sent to the department for review. So for our doctoral admissions requirements, so we do require a master's degree from a regionally accredited institution as well as a bachelor's degree. Some changes as in response to COVID-19. So the PhD in health education and health promotion and the PhD in environmental health sciences, there's no GRE required for the fall 2020. So keep that in mind when you're submitting your application. The other departments, to be completely transparent, they just haven't let me know and are reviewing on a case-by-case basis. So if you have any issues submitting your GRE score and are looking for a doctoral program, just submit it anyway. Send me an email and we'll just see what the department says. The worst case, they say no, and then you're right where you started. But honestly, we're sort of taking things as we go in response to the current climate. So here's just important information for international applicants specifically. So we will accept the Duolingo English test in lieu of the TOEFL or IELTS. It's supposed to be more user-friendly with no appointment necessary and no test center. So if you have issues with your visa getting approved in the fall term, we also consider starting one of our programs online. We have a very robust online platform, as Dr. Austin mentioned earlier. We have dedicated staff available to help you with any technical difficulties. And we will review the transcripts that you have available. Many applicants have notified us of the difficulty of getting a WES or EC evaluation. I've received a few WES evaluations, but I haven't received any ECE evaluations. The committee reserves the right to reject an applicant on the grounds of not having enough information to make a decision. So if you really can't get a WES or EC evaluation, just send us as much as you can. Worst case scenario, you won't have to resubmit an application. We'll just hold it until you're able to get us those documents. See, and the same could be said for domestic students. So if you're having trouble receiving any admissions documents due to COVID-19, just let us know so we can figure out this together. We have to stay in compliance with our accrediting body, obviously, so please be mindful of that, but we will do our best to review with what we have. So here's just important deadlines that are coming up. So we have changed our summer and fall deadline from May 1st, or from April 1st to May 1st in the summer, and from July 1st and August 1st in the fall. For international student deadlines, so that's the May 1st deadline for fall. And of course, these are our doctoral application deadlines. So here's just a list of our coordinated degree programs, all except for the MBA MPH, MPA MPH, and MSW MPH require applicants to be admitted to our partner program before they can be admitted to the School of Public Health. You will have to be admitted to both programs separately, so it's important to ensure your admission to the other program before you apply to the School of Public Health. With your permission, we can request your application documents from our partner schools, so you don't have to resubmit those documents again. And we do encourage you to write a new statement of purpose as a way to demonstrate your passion for public health and pursuing your education at UAB. And here is a list of the contact information of the most important people during your time here. They will be the ones to help guide you through your program and answer any program-specific questions that you may have. You guys will meet them all when you go into your breakout sessions. They also know all the policies of the school should any issues arise, and these folks will be one of the most important people that you meet, and they're here to help. And here's my contact information as well as our admissions coordinator, Dustin Shaw's information. Please reach out should you have any questions or concerns. We want to help get you through this process. We're all in this together. So thank you, and don't forget to visit our new website. And here's a link